With unvaccinated people continuing to account for most new coronavirus cases and serious infections, new research from Yale School of Medicine and partners is examining what still needs to be done to break down those vaccine barriers in Black and Latino communities.
Let me bring in now the senior author of that research, Yale School of Medicine's Dr. Arjun Venkatesh. Doctor, thank you so much for being here. And your study was unique, and it found several barriers still. Some of them we understand, some mistrust of the community, of the medical community, some barriers to access. But it was interesting to hear you all say that so many people in the Black and brown community want their information from not necessarily doctors.
Yeah, thank you for having me. I think what we found in this study, and we pulled together over 70 people, had in-depth focus groups with them, and really chatted with them through our community partners to learn about what their barriers to vaccination were. And what they wanted was trusted messengers, people that they might see on a regular basis who they know they can trust, their pastors, their teachers, maybe their sports coaches. And what we found is that if we can empower those trusted messengers to have facts, that we could really empower communities of color to get motivated for vaccination.
And Dr. Venkatesh, you said what surprised you most, a lot of times when you do these studies, you find that people don't have the information they need. But you say in this case, with this coronavirus epidemic, they do have access to information and they understand that there's misinformation, but yet at the same time, there's still confusion. Can you explain that to us?
Yeah, I think that there's a mistake out there to think that people don't have the facts. This pandemic is different than anything before. It's on the news, it's in the media everywhere, people are seeing it on social media. And so it's not that people haven't seen the facts, it's just that for some reason, people who are still willing out there to get vaccinated have found it too hard to get vaccinated. And so they know, we heard in our interviews that people would say there's a lot of negative stuff or wrong stuff on social media. But what we needed to do was make and figure out ways to address the real structural barriers to getting vaccinated. Is it available in Spanish so that it's available to all communities? Is our vaccine clinics set up for walk-in appointments? Do we have mobile clinics that can go out to places that are transportation deserts where people don't have access to public transportation? And so it's all about making vaccination easier and easier for a huge swath of folks out there who are willing and interested in vaccination, but it's just too hard to get it done.
And Dr. Venkatesh, you talk about a practical barrier there, but also messaging is important. But are you finding, look, science plays out this way, right? Sometimes the doctors tell us as we learn, and we've learned a lot during this pandemic, but is the messaging a problem? Or is it not just a matter of evolving science, but also when we do get the science, we're getting different messages about what to do? This booster, you need this vaccine, you need that.
Absolutely. I think one of the things we learned is that people said we don't want just trusted messengers, we wanted consistent, trusted messages. And this pandemic has been hard. Science has never moved so fast to develop so many amazing treatments, vaccines, and learnings in terms of how we combat this pandemic. It's fundamentally different today than it was a year ago. The problem with that is that if you're looking at media, you're looking at social media, it feels like it changes every week. And that sounds inconsistent, even though it's just us getting smarter and better at the science. So we need to do a better job of using consistent language, simplifying it for folks, and giving them the information that they need. They can figure it out when they hear it from a trusted source. And we have to recognize that there's a lot of misinformation out there on social media that could sound really consistent. And so overcoming that will be a big challenge in these next couple months as we really try to get folks vaccinated before the holidays.
Yeah, that's so important. And I'm sure that the things you've been learning, and you learned specifically in this study, these are some tools that we can use going forward beyond the COVID-19 pandemic, just in terms of people's access to health care in general, correct?
Absolutely. One of the things that was really interesting as we talked to folks about COVID-19 and the vaccination was that the themes that we heard are true for all of healthcare. In the same way that people of color feel mistreated by the healthcare system, seek trusted messengers, and need better access to healthcare, it wasn't just about COVID-19. It could be about diabetes, stroke, heart attacks, all diseases and conditions that we know particularly hit communities of color. And so what we hope is that the partnerships that we build with communities and the learnings that we build from COVID-19 translate into the healthcare system, and that our healthcare system is more inclusive and better engaged in communities around this country sort of moving forward.
Yale School of Medicine Associate Professor Dr. Arjun Venkatesh, thank you so much. It's very enlightening, and hopefully it can move the needle. We appreciate it.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here. to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.